Good morning, everyone, and welcome to Munson Healthcare's virtual press conference. My name is Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare, and I will be your host today. Today is Tuesday, July 20th, 2021. Munson Healthcare and local health officials have been hosting these virtual press conferences throughout the pandemic to keep you up to date on the latest COVID-19 information throughout northern Michigan. In addition to these press conferences, I encourage you to sign up for the Munson Healthcare e-newsletter, follow us on social media, or visit munsonhealthcare.org for the latest information. Next slide, please. Joining us today will be Dr. Christine Nepsi, the Chief Medical Officer for Munson Healthcare, and welcoming back Wendy Hirschenberger, the Health Officer from the Grand Traverse County Health Department. Jordan Powell, an epidemiologist from District Health Department number 10, will be joining us for the first time, so we're excited to have Jordan join us. And once again, my name is Diane Mihalik. Before I introduce Dr. Nepsi, I do want to remind everyone that we will have a Q&A session at the end of the panelists' presentations today. You can submit your questions directly through the Zoom if you're a reporter and you're logged on, or submit your questions via Facebook, and we'll get to as many of those questions at the end of today's session as possible. Next slide, please. So next, it's my pleasure to welcome back Dr. Christine Nepsi, Chief Medical Officer for Munson Healthcare. Welcome, Dr. Nepsi.
Thank you, Diane. All right, well, let's go ahead and get into our Northern Michigan numbers. So you can see here our cumulative data, as well as our percent positivity. So I am happy to report we seem to be holding steady at about a 1.3% positivity rate. We had dropped below 1% very temporarily, but we've been hanging out here for about a week or so, and we have currently 21 cases per 100,000. Next slide, please. That has translated into a steady number of COVID positive inpatients as well across our system. We are currently at 5. We have been under 10 for a couple of weeks now, and continue to hold there as well. Next slide. This is the graphic representation that we typically look at, and you can see kind of our peaks and valleys there. And you can see that downward trend and kind of us holding steady at a low number, which is a good thing. We're very happy that our numbers remain low, but I do want to take a little bit of a break from our normal of just looking at our Northern Michigan numbers and take a little bit of a broader view, just to show why we're a little concerned about the Delta variant and sort of watching closely. So here you'll see the trend line for COVID-19 cases in the United States. You've probably seen some report outs that many states are reporting an increase in their numbers, some a much more significant increase than others. But there you can see on that trend line, that sharp decline and then going up again. We do think this is because of the Delta variant, which we now know is probably quite dominant across the United States as the variant. What we know about this variant, as we've said before, is it is quite contagious, much more so than the original form or even the Alpha variant. Next slide. Here you can see kind of the hot spots. So you'll see there in Florida and some other places, the steady increase in the number of cases that are being reported. Again, some states are preparing for full-blown outbreaks as they see their numbers increase quite significantly. And what we are learning from across the country is that this really is an outbreak among unvaccinated individuals. Next slide. There you'll see, if you can remember the slide before, the geographic areas where we're seeing the most cases across the country. So you'll see that corridor there, from Louisiana and Arkansas and Missouri. That's just in the past week, and some other hotspots in Florida and kind of around the country. This is again a concern to us. So far, we are doing pretty well in northern Michigan, but still a concern. Next slide. And here you can see the unvaccinated rates. So again, right in that corridor there of Missouri and Arkansas, you can see in Florida, there are some hotspots across the country that have under a 30% vaccination rate. As a reminder, we are quite a bit higher than that in Michigan. You can see where we are kind of in the green and yellow, but this is an overlap there between being unvaccinated and these outbreaks. Those things that we talked about early on in this pandemic about hospitals being overwhelmed, staff being overwhelmed, running out of equipment. Those are some of the stories we're starting to see from some of these places that are suffering outbreaks and what many areas in the country are preparing for with this new variant. Next slide. So again, you can see here some quotes with numbers, a common theme among the worsening numbers. This is a pandemic of the unvaccinated. And we are seeing similar numbers. The vast majority of people that are getting hospitalized now, even with our low numbers, are unvaccinated people. And deaths even more so. So you can see here from the US Surgeon General, 99.5% of deaths are among the unvaccinated. So if you'll go to the next slide, this is just a reminder that vaccination is your best option. Avoiding exposure is certainly part of how we're going to get through this. But if we can avoid hospitalization and avoid serious illness through vaccination, that is really the best option that we have. Our options for treatment when people are hospitalized remain quite limited. And while we do have monoclonal antibody therapy for people with mild disease when we catch it early on, the vaccination is the much better option. Next slide. So we have given, with our partnerships across the region, over 86,000 doses of vaccine. Again, we've done really well. We are approaching 60% or higher in some of our areas of vaccinated individuals, which is great news and certainly protective. But when we look at that community immunity or herd immunity, we really need over 70% of people vaccinated for us to really break this pandemic. Next slide. Here's where we are of people in Michigan that have initiated or gotten at least one dose of vaccine. Next slide. And then here is our number, 60.7% in our region. Great news. Next slide. And this is where we see an estimation of vaccine hesitancy across the country. So, where you see those lower numbers, those lighter colors is really where we would expect those next outbreaks, specifically with the Delta variant, to be. Again, we are better than many areas of the country here in Michigan and specifically here in northern Michigan, but we are not completely out of the woods. Next slide. This is just some data for you. It's a busy slide, a lot on there, but you can see there's some really outstanding work, and certainly we are well protected in our older ages in our population, which is really what we knew early on with this this virus. Those folks were the most at risk. However, what we are seeing now with the lower vaccination rates are much younger people being hospitalized with this virus. And, it's certainly not, a piece of cake. They are sick enough that they're getting hospitalized, and that's significant. Just as a reminder, reports of complications from this vaccine are rare. Most common side effects are a sore arm, redness or swelling at the injection site, just kind of feeling not good, maybe low-grade fever, a little nausea for the first 24, 48 hours afterwards. Next slide. We do hear quite a bit from people concerned about the mRNA vaccines and that they are new and that they may have been rushed through. I do want to reiterate to people and reassure them that the mRNA vaccines have actually been around for quite a long time. We have used them before to study other viruses and vaccines against viruses, even back as far as the early 2000s with coronavirus specifically. Part of the challenge with them coming out was the expense to produce those, and then some logistical challenges with things like, storage temperatures and that kind of thing. But with the influx of money that we got during this pandemic, that really negated all of those challenges. And that is why you are seeing them come out so much more broadly now than they were in the past. Next slide. So again, please ask your questions. We know people have questions, they have concerns. Ask your primary care doctor if you have one. If you don't have a primary care physician, we do still have our Munson Healthcare Ask a Nurse line up and running. They are available to answer any questions you may have about the COVID-19 vaccine, symptoms you may have, places you can go to get tested, monoclonal antibody, any questions you may have. Next slide. And then I just want to remind people as well to meet people in their community where they're at. So you may see people still masking. So as a reminder, if you are not vaccinated and you are in a public setting, you should be masked. If you are in a restaurant, if you are in the store, if you are around people in an enclosed place, you should still be masking if you are not vaccinated. Other people who are vaccinated may still choose to wear a mask. They may be immunocompromised. We in the healthcare setting are required by OSHA to wear a mask. So hesitation for those people who may be not fully vaccinated yet, or have other issues, children can't get vaccinated. There's a lot of different reasons why people may still be being masked. And then finally, the Delta variant is kind of throwing a little bit of a wrench in things. Much more contagious. We are hearing about some breakthrough cases. So there might be a lot of reasons why people are masking. I know somebody gave my daughter a hard time the other day for wearing her mask in the store. I would just ask that people please practice respect for others, patience and kindness. Our staff have been doing this work for a long time, and we still are getting sometimes upset and angry people coming to the hospital and giving our front desk and screener folks kind of a hard time about this. I would just remind people that they are doing their job. We are adhering to an OSHA guideline for universal masking in healthcare setting, which is the right guideline, one we support and agree with. Our job really is to keep our staff and our patients safe. And, our hospitals and clinics are a place of healing. And so we would just ask that you keep that in mind, that we are a community and we will get through this together, and to show some patience and kindness and respect to those around you who may be in a different place than you. Next slide. We do still continue to ask all of our staff to screen for symptoms daily as they come into work. We still are having universal masking in place in all of our clinical settings. And as a result, all of our patients and visitors will be screened at entrances and asked to mask. That is consistent with what we think is the right thing to do and with the OSHA requirements. Next slide. And I think that was it for me. So I will pass it on to my health department colleagues. Thanks, Diane.
Thanks, Dr. Nepsi. And Dr. Nepsi will be available after the other presentations for the Q&A session. So we'll welcome you back in a minute, Dr. Nepsi. Thanks for that important update.
Thank you.
Next, it's my pleasure to welcome back Wendy Hirschenberger, the Health Officer for Grand Traverse County Health Department. As a reminder, Wendy does not have the video capability. So Wendy, I will just hand it over to you.
Thank you. So Dr. Nepsi covered a lot of great points, and I also wanted to reiterate that health departments are also following the same OSHA guidance. So in our clinical settings, we do use universal masking. We are considered healthcare settings as well, including our dental clinics here. And I know our neighboring health departments, even those who aren't on today, are following the same guidelines. So yes, if you come to a health department, you will likely be asked to wear a mask, and we ask for the same kind of kindness and respect for our staff as Dr. Nepsi mentioned for the hospital staff. So Dr. Nepsi covered a lot of the national trends and some of our regional trends. I thought I would just cover for Grand Traverse County. So we are the biggest county in our region, but you're going to see at the county level a little bit more variability than the overall regional numbers. So as we've watched what's happening across the country with the Delta variant, we're obviously continuing to look at our cases and look for trends. So we started to notice an overall increase in our cases starting on July 8th. Probably not surprising. We went from averaging less than one case a day towards the end of June to now we're up to 4 cases a day. I know those numbers are relatively low if you're listening, but it's still an indicator of what might come. So that just to us says you need to keep looking at things closely. Another way to look at it for us is our best week in June and for the year is that we had 1 case the entire week reported to us. And in our current last week, which just ended yesterday, we had 26 cases. So definitely seen an increase. Whether or not that continues or goes down is what we'll keep looking on. And then also looking at our June cases when we do our case investigations, that 6% of those cases were linked to travel and 16% to large group gatherings. And then in July so far, 32% of our cases were linked to travel either in or out. And that doesn't include outside people from other counties that travel here. And we've had some of those cases as well that we do the initial case investigation on and then transfer them back to the community they came from as far as some of the follow-up as well. But we are aware of them and we do monitor them. And 24% of our July cases are linked to large group gatherings. So I just wanted to show, you don't have to see the small print on these 2 graphs, but it more is just to show that the initial one is for percent positivity, that we've seen an increase the last 3 weeks from near 0 now up to 2.8%. So again, still a relatively low number. I think our highest was around 15% for our county, but it is still something we're keeping an eye on. And if you look at the lower right hand corner of the graph, you start to see a little bit of an upward blip. And so that's what we're watching, hoping it's just a small wave, not a big wave coming at us again. And then the same on the graph on the right hand side of the cases per million. We were at 0 during that good time in June, and now we're up to 43 cases per million. And likely, if you look at the dashed line towards the end, that's a projection. So that'll probably continue to go up some, and we'll continue to follow that. Next slide, please. Okay. So as far as vaccinations in our county, in general, just general vaccinations, we're encouraging everybody to think about back to school. So there are, requirements for vaccinations that are outside of COVID. So if you have a student athlete, now's the time to make sure you're getting them vaccinated. Whether it's the regular vaccinations to get them back into school, or if it's the COVID vaccine, if they get vaccinated now for COVID and they get their first dose, they would be fully vaccinated by the week of August 24th. So we're starting to get to that point where if you want to have your child vaccinated when they start school, we're getting close. And the next 2 weeks is really when you need to initiate it because of the spacing of the Pfizer vaccine, which is approved for those 12 and over with 3 weeks in between the doses. So of our 12 to 19 school age population and those who are eligible, of the 12 to 15-year-olds, we have 35.8% that are fully vaccinated and 56.5% of the 16 to 19-year-olds who are fully vaccinated. So making some progress, but we would definitely like to see those numbers be much higher prior to the school year. Remember when kids are heading back to school, it's going to be a mix of those who are eligible to be vaccinated and those who are not, as well as staff, some of whom may be immunocompromised. A lot of them were vaccinated earlier this year, so that's good, but we do want to try and get as many of those groups up to that 70% or higher threshold as soon as we can. Next slide, please. And then this graph just shows our vaccination progress as a county as a whole. I know our health department has done close to 47,000 doses since the beginning, but this is for our whole county. We have a close to 69% initial dose, so we're getting closer, we're inching closer, and 65%, a little over that for the completion. But then if you look at the breakdown by the age groups, I just talked about the 12 to 15 and 16 to 19-year-olds, but we also really need to focus on the 20 to 29-year-olds, the 30 to 39-year-olds, and the 40 to 49-year-olds. The other groups were eligible sooner, and so they're obviously naturally going to have a higher rate. But so we're looking really good for that 50 plus group. So we really do want to try and get some of the parents of school-age children vaccinated, and those who are in the workforce that are in the kind of the early 20s to 40s as well. Next slide, please. We also, because of the kind of the anticipated uptick with cases for the Delta variant, we are expanding our testing. So we did do some increased testing last week. We increased the hours again this week. So we have been doing Monday, Wednesdays from 9 a.m. to 12 and then 1 to 4. And then we added on Thursday this week as well from 11 a.m. to 3 p.m. So the testing actually is performed in the back parking lot of the health department. You remain in your car. We do have a carport that covers you from either rain or the heat. And then staff come out and administer the test. So we have seen an increase in the tests, and that's why we're increasing the hours, because the demand has gone up. So last week we performed, or I guess this week so far, 69 tests, and that's up from an average of 14 the previous 2 weeks. And then just yesterday we did 26 tests, and 2 of those were positive. So continuing to monitor that. Next slide, please. And then lastly, this is our vaccination schedule. Just a reminder that we now are offering Pfizer, Moderna, and Johnson & Johnson. So we've had people come who needed to get a second dose of one of them, and so we are able to accommodate that now. We are vaccinating right this week, Tuesday and Thursday, at the Cherryland Mall location. Tuesdays are usually a little bit later, trying to maybe get some working parents in from 11 to 6:30 p.m. and then also Thursdays from 9 to 4. And just a reminder that guardian does have to be present for that 12 to 15-year-old group, and we do need consent for the 16 and 17 who might be able to drive themselves there. So I think that is it from me. And I do need to leave. I have another staff engagement that I need to get to, but I appreciate the time and pass it on to the next person.
Great, thank you, Wendy. Thank you again for all that you're doing to get vaccinations and testing continuing throughout the region. And once again, Wendy does have to drop off this call, so she won't be available for the Q&A session. But if anyone does have any direct questions, you can contact Wendy directly or send them through the Q&A feature or ask them on Facebook, and we'll make sure your question gets answered. So next, it's my pleasure to welcome Jordan Powell, who's the epidemiologist for District Health Department number 10, to give us an update on what's happening in her jurisdiction. Welcome, Jordan.
Thank you. I'm happy to be here. Thanks for having me. Our cases and trends are following what the region and Grand Traverse and the state overall have been seeing. So I'm announcing that our cases are remaining steady. That a little bit of variability between 23 and 22 cases, but not much. So we have, over the weekend, we did see a few more cases than we're used to seeing. So we may be part of that slight increase as well. And as Wendy said, hoping it's a small blip. Our daily cases per million have increased over the past week as well. These are the last reliable numbers that we have. So it increased from 11.29 to 12.99, and our percent positivity has also increased slightly, about 0.45 or 0.42%. So we are seeing the same trends. Our total vaccines that we have administered as an agency is 103,788 as of last Wednesday, almost at Friday. And in our entire 10 county coverage region, we have seen 216,792 doses of vaccine administered to our residents. So about 54% of our eligible population has initiated vaccination based on that number. We continue to do pop-up clinics as well. There is one this weekend in the region that Munson covers, and that is at Arcadia Days in Manistee on Saturday. So we'll be there from 10:30 to 1:30. We have folded in walk-ins to our regular clinic schedule. So that varies in each county. So you may want to check our website for more information, but people can go ahead and come in any day of the week. We just encourage you to call ahead and make sure that someone who can administer the vaccine is there on that day. And then we have our COVID-19 vaccine page where you can find any information, also suggest places for pop-up clinics. And soon we will be adding a space where you could submit your vaccine record if you were vaccinated, maybe out of state or with the VA. That way we can get you counted in our numbers. We want to make those as accurate as possible. So we'll have that as an option. And another option, if you don't have online capabilities, you can bring that card into any of our offices and someone will get you in our system. Our coronavirus page, as always, has our most up-to-date information on the coronavirus. And then you can also sign up for our public health alerts and get those through email if you'd like.
Great. Thank you, Jordan. We really appreciate that update. And again, thanks to you and your team for everything you're doing to continue with vaccinations and testing and pop-up clinics. So it's exciting news. Good work. Now I would like to welcome Dr. Nepsi back. And Jordan, I'll have you stay on as well for the Q&A session. We are getting a couple of questions in from reporters. Again, you can submit them through the Q&A feature, or if you're watching live on Facebook, please submit them through Facebook and they will get to me. So Dr. Nepsi, I'm going to start with you. The first question is from one of our reporters. Do you expect a noticeable increase in COVID cases as the Delta variant moves through this area? If so, when would you expect that to happen?
Yeah, it's a great question. And I'll just say, yes, we do expect it to. So, one of the things we know about this variant, one of the things we talk about, and Jordan, you could probably weigh in as an epidemiologist, is something called the R0, which is how easily a virus spreads. So when you look at something like influenza, that's got an R0 around 1, which means for every person infected, they're likely to spread it to one other person. When you looked at the original strain of the coronavirus, its R0 was a little over 2. So one infected person would spread it to 2. This Delta variant is an R0 of like 3.5 to 4. So it's much, much more contagious. And the only thing really protecting us right now is our high immunization rate. So we have pockets around our region where the immunization rates are much lower than they are in others. And so we do fully expect that as we walk around unmasked, get together more often, are eating out, or going to stores, all of that kind of stuff, that we are at risk, specifically with our unvaccinated population, for getting this variant much more easily and spreading it much more easily.
Jordan, are there any additional comments you want to make on that for your jurisdiction?
No, I think Dr. Nepsi covered it.
Okay, great. Next question, Dr. Nepsi, has the percentage of serious cases among younger age groups remained fairly low, or has that increased to any degree as a result of the Delta variant?
Well, we saw an increase in the number of pediatric patients getting infected with COVID-19 during our last surge. And I think that was really a reflection of how many people had it. So, you heard Wendy mention that we were up to about 15%, and that was pretty average kind of across our region. With that, we saw a much larger number of kids getting infected and then getting really sick with it. We still see children and young adults getting sick with COVID. We're seeing those percentages change a little bit because you can see our older population has a much higher vaccination rate, so they're less likely to get it. So that's in part why we're seeing more kids with it. But being young does not necessarily protect you from getting this disease seriously. It's just really hard to predict who is. But What we know or what we expect is that the Delta variant will continue to spread, and it will spread among unvaccinated people much more fast than it will in any place else. And because our younger people are the ones that are less likely to be vaccinated, that's where we're going to see the cases. And then a certain percentage of them will get ill.
And Dr. Nepsi, in a related question, earlier we heard about some complications that maybe younger people were experiencing. Are there any new complications that you're aware of or anything you're concerned about?
Well, I just think that, again, there's a little bit of misinformation out there. You hear every once in a while that you have to be, older or have some other illness to get a serious case of COVID-19 and end up in the hospital. And what we know is that's just not the case. Healthy people can get bad COVID and end up in the hospital from it. So, we did see a lot of those complications, or a lot more of them in this state with children. We were averaging about 40 to 50 kids hospitalized across the state for a couple of months there. That is finally trending down, but we are really cautious, since that's sort of the same age group that's not likely to be immunized, about what this Delta variant could mean. But certainly if you look across the country, and if you look nationally, just because you're young and healthy does not mean that you can't get this disease seriously and end up in the hospital.
Thank you, Dr. Nepsi. Jordan, this next question is from you. It's from one of our reporters who's listening in. Can you comment, at least for your jurisdiction, at how well we are doing on school vaccinations? This person remembers hearing people were falling behind on those during the pandemic.
Yeah, I think we're trying to partner with our schools as the back to school season is sort of here now, and getting back in the schools to vaccinate people. I will say our 12 to 15 years age group, I know that Wendy shared her numbers. Ours are lower than hers, and DHD10, 14.9% of our 12 to 15-year-olds have been fully vaccinated. And then when we move to the 16 to 19-year-olds, it's 26.2. So those numbers are low, and we are trying to do what we can to increase those. So I'm sure we'll be holding more pop-up clinics at schools that will allow us to be there and have all kinds of opportunities for children to get vaccinated.
Right. And Jordan, is there still time to get fully vaccinated prior to the start of the school year?
Yes, I think Wendy had it on her slide. I think she
Yeah.
said if you get vaccinated this week, you'll be vaccinated and fully vaccinated in time for back to school, probably right when schools are starting. So encourage everyone to get those as early as possible.
Jordan, I have another question from our reporter. And I'll ask this one of you first, and then I'll ask Dr. Nepsi to weigh in as well on the third question. The second question is, what are we learning from contact tracing about whether anything's changing and how the virus is spreading? Are we able to do more through tracing with case counts lower than during that spring surge, when I know we were overwhelmed trying to do a lot of, or the health departments were overwhelmed trying to do a lot of the contact tracing?
Yeah, I can't really speak to what we're learning. I will say that our contact tracing team is able to do more in-depth interviews and really contact people quicker than we were during that spring surge. So much more manageable caseload, and being able to try to contact people more than once, things like that.
And Dr. Nepsi, I think you commented earlier that we do know that the Delta variant is more contagious, but have you heard anything else related to contact tracing that is anything new?
Well, I think Wendy's slide sort of indicated we're seeing a lot more spread from people traveling. And so that's our local people going out and traveling. And then coming back. I think most people are aware that, if you're on an airplane or train or anything like that, that you are supposed to remain masked regardless of your vaccination status. But certainly once you get to where you are, we've seen a relaxation of kind of those mitigating factors that we've been following for a long time of distancing and hand washing and masking across the country. And so we are seeing people go out and likely bring it back to us. And then again, you are putting yourself at risk anytime that you are close around other people who may not be vaccinated.
And Dr. Nepsi, I'm not sure if you can answer this question, but I'm going to ask it of you anyway. We don't have a representative from the state on this call, but the reporter is asking what effects, if any, are we seeing from the state's vaccine lottery?
Actually, I did get some data on that they saw, I think, 135% increase in the number of people vaccinated with that lottery. So it was encouraging. I read another article today, about different ways to encourage people to get vaccinated, but certainly having that, carrot to get people to go. I think we know people that are firmly against immunizations likely aren't going to be reached with those kinds of things. But we have a lot of people who just don't think that they're at risk, or it's just inconvenient for them. So I think our health departments would say the same as they're going out in kind of their mobile units and hitting restaurants and wineries in different places. There are a fair number of people, or workplaces would be another one, who are like, yeah, you come to me, I'll go ahead and get my shot. They just don't want to, for whatever reason, can't or don't take the time to kind of come to the health department and that kind of thing. So we still have, I think, a certain percentage of our population that could still be vaccinated and help get us where we need to be.
Thanks, Dr. Nepsi. One last question for you, Dr. Nepsi. Are there other COVID-19 variants that are as concerning as the Delta variant?
There are. So, if you get onto the CDC website, they have a whole page on variants of concern. And I think we went over this a little bit at the last press conference about what is a variant of concern. And there are different things that they track. One would be how contagious it is. One would be how virulent it is or how sick it makes you. So there is a Lambda variant. There are a couple as they start to come out and we see them that we follow. The problem is when they're early on in the identification, we don't always know a lot about them. And depending on where they are, especially if they're popping up in other countries that maybe don't have the public health infrastructure that we do, it makes it a little hard to get good data. But there are quite a number that are being followed and looked at. The CDC website is a great place to kind of keep on top of that.
Thanks. And Dr. Nepsi, as a pediatrician, can you comment on the American Academy of Pediatrics recommendation for masking in schools that just came out, I think, yesterday, right?
It did. It just came out, and the American Academy of Pediatrics is recommending universal masking when kids go back to school over the age of 2. So we know that you don't usually go to school under 2, but so basically anybody that's going to school, they are recommending universal masking. They shied away from saying, and there should be mandated vaccines, but they did sort of put a caveat in there that would likely or that would not necessarily not happen where they made that recommendation. So I think a lot of people, you're seeing universities and other workplaces sort of go that direction, and the AAP kind of draw a line in the sand. I think that they feel very strongly that we want kids back in school. We know that there's a whole social infrastructure and support for those kids, and having them in school is the right spot. Obviously it impacts families, especially with dual working parents and all of that. So, school is the right place to have those kids. But if we're going to keep them safe in school without them having the ability, many of them, to be vaccinated, then universal masking is the way to go.
All right, thank you so much, Dr. Nepsi and Jordan, for joining us today. Those are all the questions we have received through our Q&A panel here. So again, thank you for all the hard work that you continue to do to keep us informed and to continue to get vaccinations and testing available in our community. As a reminder and sort of a wrap up, we always show this slide that is a summary of all the community resources that are available in Northern Michigan, including the 211 Michigan line, the Area Agency on Aging of Northwest Michigan Health Services. We saw the update from the Grand Traverse County Health Department. Lisa Peacock was not able to join us today from the Health Department of Northwest Michigan and Benzie-Leelanau District Health Department, but you can get updates at these two websites listed here. And again, thanks to Jordan for the District Health Department number 10 update. So again, lots of great resources out there depending on where you live and what information you're looking for. Also encourage you to continue to go to munsonhealthcare.org, and the CDC website is a wealth of great information that we often link out to and we follow. Once again, I encourage you to sign up for our biweekly e-newsletter. Follow Munson Healthcare on Facebook, LinkedIn, Instagram, Twitter, and YouTube, and visit munsonhealthcare.org. Thanks again, everyone, for joining us today. I'm not sure when the next press conference will be due to some scheduling conflicts, but as things change, again, signing up for the e-newsletter and visiting munsonhealthcare.org, you will find the latest information there. So we will announce when the next press conference is shortly. Thanks, everyone, and have a great day.